Evaluation of services. Ongoing evaluation will provide evidence for key decision points as the HTP services develop. This will enable the program to accurately determine whether it is achieving its strategic outcomes. Evaluation will tell the program if HTP services deliver improved outcomes for customers, including a clear understanding of what works for whom, and how the services work for claimants with protected characteristics. Effective delivery mechanisms. Value for money for the taxpayer. This ongoing evaluation will draw on 3 methods at different stages of the HTP to assess these things. Impact evaluation. We will use impact evaluation to assess what changes have occurred at least partly as a result of the HTP's changes, the scale of those changes, and the extent to which they can be attributed to the HTP. The impact evaluation will assess this in a number of ways, including impact assessment, which uses quasi-experimental analysis of administrative data to determine the causal effects of the HTP services on customer outcomes. It does this by comparing to customers with similar characteristics but who didn't receive the HTP service, a comparison group. Customer surveys gathering perspectives on a range of aspects of their experience. Qualitative research with customers and staff to understand impact of the HTP services on experience. Based on the HTP's strategic outcomes, examples of evaluation questions we will seek to answer are: do customers report having a better overall customer experience when using the HTP service than when using DWP business as usual services? Are customers less likely to dispute their benefit decision when using the HTP services than when using DWP business as usual services? Is there reduced need for health assessments in the HTP services than in DWP business as usual services? Process evaluation. We will use process evaluation as the HTP services develop to assess if changes are being implemented as intended, whether implementation is consistent across sites, and whether there have been unexpected factors influencing delivery. This will consist of a range of methods including qualitative research with staff and customers to understand consistency and effectiveness of delivery. Surveys with staff and customers to understand their experience of using the service. Data collection from our systems to understand how the service is being delivered. Based on the HTP's strategic outcomes, examples of evaluation questions we will seek to answer are: do customers experience any barriers to accessing the services? What worked well and less well for which customers when using services? Do staff have the right resources to deliver the service as intended? Value for money assessment. We will use value for money assessments of the HTP services to weigh up the total monetizable benefits against the total cost of implementing and delivering the service. This involves factoring in economic, social, and environmental costs and benefits, whether intended or unintended. Value for money assessments will utilize the findings from the impact and process evaluation strands. For example, if the process evaluation shows that a service is more productive due to greater efficiency, the value for money assessment will determine the monetary value of that increased productivity and add it into the calculation of total costs and benefits. This process provides assurance that public money is being spent in a way that maximizes the value to the taxpayer and delivers against the cost of funding the program. As set out in the Green Book, this kind of economic appraisal is at the heart of any program business case, and as such this process provides fundamental information required for the HTP to demonstrate that it has delivered against the commitments it made in its business case. Any of the HTP services that are tested at scale will be assessed using this method and will be compared to DWP business as usual services when it is appropriate and proportionate to do so. Examples of evaluation questions we will seek to answer are: has the HTTP service been cost-effective? What were the costs of delivering these services? An example of our approach: apply for PIP. Figure 4. An example of our approach to evaluation: apply for PIP. As part of the transformation of the end-to-end personal independence payment (PIP) journey, a new online service to claim PIP is being developed. This is being designed, built and iterated over time, and the service will gradually be scaled up to be available for all citizens. To support this, we are delivering a complementary evaluation approach that provides robust evidence to inform design and scaling decisions at the right points in time. During the program's initial testing phase, we have delivered early process and impact evaluation to explore how Apply for PIP has affected customer experience, engagement in the application process, and application journey times. Looking ahead to phased rollout via gov.uk, we are working to develop a geographical-based implementation approach that will enable us to deliver robust and timely evaluation evidence whilst ensuring that the service can continue to iterate and scale. Examples of evaluation questions we will seek to answer in this next phase of the evaluation are: does a self-serve online application option remove barriers for citizens applying for PIP? If so, how? Are claim processing times of the digital form quicker than for other application routes? How do staff experiences of processing claims differ by application route? End of Figure 4.